Good evening, everyone, and once again, welcome back to Karmanya National Seminar with paper and poster presentation presented by Team Ayurapta. First of all, I take this opportunity to thank our participants for their patience. Due to some inconvenience on the part of the organization, it couldn't happen on time. So thank you all. And before we get started, I would like to welcome our respected panel members. We welcome you all. So we can start the presentation with a paper. I invite Dr. Shamli Hiware for our first presentation. I invite Dr. Shamli.
Good evening, everyone. Next, I invite Dr. Nisarga Aram for the paper presentation on the topic concept of Basma Pariksha. Dr. Nisarga?
Yes, sir.
Okay, doctor, please share the screen, doctor.
Wait a minute, doctor.
The screen is visible, doctor. Please start the session.
Okay, doctor. Good evening, everyone. I am Dr. Nisarga, third year PG scholar from RSBK department. Today, I am talking about Basma Pariksha. Introduction. The term Basma stands for holy hash, which is an elaborate process involving Shodhana followed by Marana. Rasataragni has mentioned Shodhana as a process of elimination of doshas from the Lohadi Dhatus by subjecting them to a procedure like Peshana, Mardana, Bhavana, etc. with a previously prescribed Aushadha drug. Marana is described as the process by which metals and minerals are grounded with the liquids and when it reduced to Basma by heat. For proper achievement of Paka of Rasadi Dhatus, a quantum heat in the form of Putta is required, which should be neither less nor more. To ensure that the Basma is properly prepared, a set of parameters are specified in the various Ayurvedic textbooks as well as the Ayurvedic Formulary of India. Properties of Basma. One of the remarkable properties of Basma is termed Rasi Bhavana, which indicates that accurately prepared Basma upon ingestion must be easily absorbable, adaptable, and assimilable in the body and must be non-toxic too. Another property of Basma is Shigra Vapti, which indicates that after Marana, Basma quickly spread in the whole body. Basma has also been explained as Agni Deepana as it increases metabolism at the cellular level and acts as a catalyst. These characteristics of Basma are comparable with the action of nanoparticles in the body, which are biodegradable, biocompatible, and non-toxic in nature. Basmas are believed to be more efficacious than any other healing system because these metals and minerals do not react at the cellular level to the body and being insoluble can enter the body stream. These particles are more biocompatible as compared to any chemical produced entity, similarly to biological produced nanoparticles. Basma as compared to its plant drug counterpart has more stability over a longer period of time. More palatability requiring less dosage form is easy to store and handle along with the sustained availability. Coming to Basma Pariksha parameters, Apunarbhava Nischandre Slakshnatam Smukshmatam Laguhu Reka Purnam Niruttanam Cha Nirdumatvam Tata Varitaram Avami Cha Nisvadu Mrudu Varankam Dante Kachakacha Bhavam Dhatunam Basma Nirnayam Tamram Amla Pariksham Syat Rasit P Parikshitam. Physical parameters for Basma Parikshas are: first one is Varna. Acharyas have mentioned a specific color for each Basma. Alteration in the specific color suggests that Basma is not prepared properly because a particular metallic compound formed during Basma preparation possesses unique color. Significance of Varna. Specific color is mentioned for specific Basma. The color may be indicating the specific chemical configuration of the Basma. So it seems important to correlate the color of the prepared Basma with the classical reference. Next, moving on to Nischandratva, means lusterless. Basma must be Nischandra before therapeutic application. For this test, Basma is observed under bright sunlight to assess the presence of any luster. The presence of luster implies that the Basma still needs further incineration. This test is specially described and done for Abraka and Swarnamakshika. If Abraka Basma contain Chandrika, it causes Prameha and Mandagni. Significance of Nischandratva, the prepared Basma should be free from the metallic luster and shine even on the observing through a magnifying glasses, which indicates the presence of any free metal. Next one, Varitara. Vari means water and Tara means to float. This test is applied to assess the lightness of Basma. A small amount of Basma is taken and sprinkled over the water taken into a beaker. Accurately incinerated Basma will float on the water surface. Significance of Varitara test. Floating of Basma signifies the microfineness and lightness of the Basma particle. Lighter the particle, surface tension of water does not allow the particle to sink and keep them floating on the water. Next one is Unnama. This test is subsequently performed after the Varitara test. Basma is placed slowly upon the water, and if it does not sink even after placing grains upon the Basma, but floats like a swan, such Basma can be considered to be accurately prepared. Unnama Pariksha is known as Uttama Pariksha. Significance, it indicates the very lightness of Basma and also further revalidates Varitara Pariksha, that is nanoparticle concept. Next is Reka Purnata. This test is applied to assess the fineness of Basma. Basma particle should be of minimum size for easy absorption and assimilation in the body. Basma is taken in the middle of the thumb and index finger and rubbed. If it fills between the creases of fingers, it is called a Britaloha. This is a classical qualitative assessment for assessing the particle size. Significance of the Reka Purnata, it indicates the minuteness and fineness of the Basma. Next is Slakshnatvam. It is the tactile sensation produced by the Basma by simple touch with the fingertips. Properly incinerated Basma attains this quality. Significance of the Slakshnatvam. Slakshna Basma indicates uniformity in the texture of the Basma and fineness of particle size. Moving on to Sukshma. Sukshma implies a fine form, and the prefix su added to the Sukshma implies very fine form. This Pariksha also talks about the fineness of Basma particle. Significance, Basma should be Sukshma so that it can be easily absorbed and assimilated into the body. Next one is Anjana Sannibha. Anjana is a smooth in a character that it can be very safely applied to the eyes without any irritation. So it also refers to the fineness and smoothness of Basma. Significance of Anjana Sannibha. Properly incinerated Basma should be smooth and should not cause any irritation to the mucous membrane of the gastrointestinal tract. Next one is Niswadu. When a small pinch of Basma is tasted, it is tasteless. That is Niswadu. It should not contain any taste like Amla, Kashaya, etc. rasas, which is also a qualitative parameters of Basma. It signifies palatability of the Basma. If Basma contains any taste, it indicates Basma is not formed properly. Next one is Awami, a pinch of basma when taken orally should not produce nausea or vomiting sensation. And this test is done specifically for tamra and tutta basma. Metallic taste, nausea, vomiting, etc. is felt when Ashuddha tamra and tutta basma are consumed internally. It signifies the acceptability of the basma into the body system. Next one is Nirdumatva. This is not a common test applicable for all the basmas. This is applied mainly for haratala and a drug contained gandhaka. Some portion of the basma is to be ignited on the fire to observe whether fumes are coming out or not. Its significance, the presence of the fumes indicates that the marana process is complete and some more puttas are to be required to complete the process. Next one is Dante Kachakachaya Bhava. When a basma does not feel gritty and chewing, that is Kachakacha Bhava and has consistency like a pollen grain of the Ketaki, then it is said to be formed properly for use. It indicates the particle size of the basma. Amla Pariksha. This Pariksha is to be carried out during the Putta procedure when a basma is kept mixed with any Amla Dravya, example like curd, lemon juice, etc. No discoloration in Amla Dravya is seen. It is the specific test described for the Tamra basma. Significance of Amla Pariksha. This Pariksha indicates the presence or absence of free metal in the prepared basma. If any free conjugated metal is persistent in the basma or the conversion of process is not complete, then such basma reacts with the amla dravya. And some salt compounds are formed which may be responsible for the change in the color of the amla dravyas. Next, moving on to chemical parameters for basma pariksha. Apunarbhava. Prepared basma is mixed with an equal quantity of mitra panchaka, that is guda, gunja, madhu, gruta, and tankana. This mixture is taken in a musha and it is to be heated on a gas burner till all the organic matter burns. After self-cooling, the mixture inside the musha is taken out and absorbed. If it does not contain any free metals, then basma is said to be apunarbhava. According to Rasatarangani, it is also known as Nirutta Basma. The significance of Apunarbhava during this scientific test, an unstable metallic compound can reduce as a metallic state by the carbon reduction process. The absence of reduction denotes Marana process is complete and Basma attains Apunarbhava Pariksha. Mitrapanchaka Gana Dravya used may act as a source of carbon at that particular temperature. Next one is Nirutta. Raupya is mixed with basma and heated vigorously in the fire. If not even a little amount of basma mixes with raupya, such basma is called Nirutta basma. According to Rasaratna Samuchaya and Rasendra Chudamani, it is also known as Apunarbhava. In case of Nirutta Pariksha of Rajata and Naga basma, the use of Tamrapatra is prescribed for testing of basma instead of raupya. In Anandakanda also, the use of Tamrapatra has been mentioned only for the testing of Raupya Basma. Significance of Nirutta, this test signifies the complete conversion of metal into Basma form. It can be considered the chemical analytical test, specifically meant for dhatus and indicate the stability of the Basma. Coming to conclusion, Ayurveda has mentioned many parameters such as Apunarbhava, Nirutta, Nirdumatva, Rekapurnata, Varitara, etc., which are equivalent to some physico-chemical testing parameters described in the modern science. Free metal may be present in the basma after Marana process, which could be very fatal. Therefore, basma pariksha is necessary before its consumption. Thank you.
Thank you, Dr. Nisarga, for this wonderful presentation.
Thank you. Thank
so
you.
Next, I invite Dr. Sheikh Praveen for the presentation. I invite Dr. Sheikh Parveen.
Yes, ma'am. Good evening.
Good evening, doctor.
Hello.
Yes, you are audible.
Oh. Hello. Can you hear
Hello.
me?
Yes, doctor. You are
Yes,
audible,
doctor, you
doctor.
are audible.
Please share the screen, doctor.
Yeah, okay. Uh, Unable to share. Can I share PPT?
Yes, doctor. Please share.
Dr. Pravinshik, can you please send your PPT to my WhatsApp, doctor?
Yeah, okay. Send me.
Okay. We will call you next, doctor. Next, I invite
Okay, okay.
Dr. Madhuri Vijay Jagadap for the paper presentation on the topic head injuries. Dr. Madhuri. Hello, Dr. Madhuri Vijay Jagadap. Are you there? Hello, Dr. Madhuri. Are you there? Okay, next I invite Dr. Uttam Kumar for the paper presentation on the topic concept of Kshirabasti in Garbhashosha. Dr. Uttam Kumar, are you there? Dr. Uttam Kumar, are you there?
Yes, sir. I'm
Okay, okay, doctor. Please share the screen, doctor.
okay, sir. Just a minute, sir. Good evening to all. Myself is Dr. Uttam Kumar Sutradhar, second year PG scholar from Department of Panchakarma. I'm here to presenting a topics on concept of Shirabasti Garbhashosha, that is IUGR. What is the definition of IUGR? Intrauterine growth restriction is said to be present in those babies whose birth weight is below the 10th percentile of the average for the gestational age. There is some fact about IUGR. IUGR associated with 3 to 10% of all pregnancies. Perinatal mortality rate is 5 to 20 times higher for the growth retarded fetus. Second leading contributor to the perinatal mortality rate. 20% of all stillbirths are IUGR incidence of interpartum asphyxia in cases of IUGR has been reported to be 50%. Early and proper identification and management lowered this perinatal mortality and morbidity. Types. There are two types of IUGR, that is the symmetrical or type 1 or asymmetrical or type 2. This is the difference between the symmetrical and asymmetrical IUGR. Symmetrical is uniformly small and asymmetrical is head larger than the abdomen. Ponderal index is normal in symmetrical, and as in asymmetrical it's low. Head circumference and abdominal circumference ratio and the femur length and abdominal circumference is normal in symmetrical, and asymmetrical is elevated. Etiology: genetic disease or infection intrinsic to fetus in this is the cause of symmetrical and asymmetrical chronic placental insufficiency in extrinsic to fetus. Total number of cell is less in symmetrical, and cell size is normal in symmetrical. In asymmetrical is the cells number is normal and cell size is smaller. Neonatal course complicated with the poor prognosis in symmetrical, and asymmetrical usually uncomplicated having the good prognosis. So there is a causes of IUGR. There's a maternal causes are such as pre-eclampsia, hypertension, prior IUGR, upper uh, substance use use or abuse. Genotype and placental and cord abnormalities are placental tumors, single umbilical cord artery, circumvallate placenta, and fetal factors are congenital heart disease, torque, infection, malaria, then trisomy 18 and trisomy 21, this is a Down syndrome. This is the diagnosis of IGR, identifying the mothers at risk, poor maternal nutrition, poor BMI at conception, preeclampsia, renal disorder, disease causes vascular insufficiency, infection, stroke, um, poor maternal weight gain during the pregnancy. This is a diagnosis, how we can diagnose the IGR. Clinically, how palpation of uterus, fundal height, liquor volume and fetal mass, and symphysis femoral height closely correlated with the gestational age after 24 weeks, lag of 4 centimeters or more, that is IUGR, maternal weight gain, stationary or falling during the second half of the pregnancy, abdominal girth stationary or failing. ANC profile, UG to be repeated 2 to 3 weekly, and diagnosis of IUG and type, head circumference and abdominal circumference uh, ratio more than 1 before 32 weeks equal to uh, and 32 to 4 34 weeks less than 34 after. Then head circumference and abdominal circumference ratio is elevated in asymmetrical IUGR, normal in the symmetrical IUGR. Abdominal circumference is the most sensitive parameter. So ultrasound Doppler parameters to presence of diastolic noise suggest the incomplete invasion of placental trophoblast to uterine spiral arteries. Also predict the possible development of the preeclampsia. Normally, diastolic flow increases as a pregnancy progression. Middle cerebral artery increased diastolic velocity, the brain spraying effect is compromised in fetus. These are biochemical markers, elevated level of maternal serum alpha fetoprotein and HCG, a level in the second trimester are markers of abdominal uh, placentation and the risk of IUGR. We can correlate it, the asymmetrical IUGR in Ayurveda, according to Ayurveda, is a Garbhashosha. In Garbhashosha, what is the Garbha Spandana and Anunnata Kukshi? Anunnata Kukshi. So that means absence of weakening and decrease of the fundal height of uterus. This is the picture of in right side. The baby is normal and left side is the IUGR unit. So what's the nidana of IUGR? Garbhashosha. Vatavipanna evam shushati garbha sa matuhu kukshi na pureti manda spanda teja. According Susrut Samhita, Sharistan, 10th chapter, by 57 number sloka. That means Acharya Susrut mentioned that when the fetus is afflicted by Vayu, it dries up and does not attain the proper growth in the abdomen. There is the abdominal height is less than the corresponding gestational age. This is the Vatavipanna Garbha. संप्राप्ति घटक दोष वात प्रधान त्रिदोषज दुष्य रस एंड रक्त एंड स्रोतज रसव एंड रक्तव अधिष्ठान गर्भाशय एंड रोगमार्ग अभ्यंतर. Then चिकित्सा सिद्धांत for गर्भशोष by Ayurveda. According to Sutra Samhita, Sutrasthana, he has mentioned that Tatra Prapta Bastikala has Shira Basti Prega, Medhana Upaiga Eti. And according to Charaka, he has mentioned that Sita Kashamara Madhuka Madhuka Hitam Uthapane Payaha. They have given the importance of Paya means Shir. And Shirabasti in classic. That was in classically Shirabasti like Shatabari Shirabasti, ಶತವರ್ಯಾದಿ ಶಿರವಸ್ತಿ ಎಷ್ಟು ಮಂದಿ ವಿದಾರಿಸಿತ ಶಿರವಸ್ತಿ ಶತವರಿ ಅಶ್ವಗಂಧ ಫಲಕೃತ ಶಿರವಸ್ತಿ we can practice according to the patient condition. And with drugs, what are the drugs we can use in ಶಿರವಸ್ತಿ and ಎಷ್ಟಿಮದು it has a effect of ರಸಾಯನ ಬಲ್ಲ ಗರ್ಭ ಪೋಷಕ ಜೀವನಿಯ ವಾತಾವರಣ and antioxidant. ಗಂಭಾರಿ that is a ಕಾಶಮರತ್ ತ್ರಿದೋಷ ಶಾಮಕ ಬಲ್ಲ ಬ್ರಹ್ಮನಿಯ ರಸಾಯನ effect. And Shatavari, it has the effect of Rasayana Balla, Snigdha Jivaniya, antioxidant property, and Vidarikanda, that was the Madhur Rasa, Madhurabhika, Vatashamak property. So, benefits of Shira. Then over the Kashyap Samhita, Kalpasthana 7 chapters, he has mentioned that Karvascha Yasa न विवर्तनेच पुष्टि दृढत्वं लभते च गर्भः. That means Kashyap explained the benefits of using a meal. The fetus which does not grow properly achieves nourishment and stability. And after giving that, using the Shira. This is the probable mode of action of Brahmanya Ganasita Shirapasti. Dominant, we are using that drugs almost are Madhura Rasa, dominance of the Madhura Rasa and Snigdha Shita Guruguna and Shita Vira and Madhura Vipaka and dominance of Prithvi and Apa Mahabhuta through the Upasneha and Upasvedanaya, Vatashamanya occur and Brahmaniya and Garva Pridhikara Bhava is occur. So this is the probable mode of Shirabhasti. So we can use this Shirabhasti at after the age of the 8 month of pregnancy. Thank you. This is my.
Thank you, doctor.
Thank you, Doctor. Next, I invite Dr. Sheikh Parveen for the paper presentation.
Thank you, sir.
And before going to further presentation, dear participants, your maximum time 8 minutes. Kindly do time limit.
Dr. Parveen Sheikh, are you there?
Yes, sir.
Doctor, please start the session, Doctor.
Okay. 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 Good evening, everyone. Topic of presentation is scientific way of Dravya Sangrahana. Here the importance of Dravya Sangrahana. Due to global popularity of Ayurveda, there is a constant increase in demand of herbal drugs in last few decades, thus exerting the huge pressure on natural resources. And in medicinal plants, the secondary metabolites or active principles are made available through properly executed harvesting techniques. Next. These are the characteristics of Dravya to be collected. They should possess the characteristics of Krimi Anupaha, that is not affected by Krimi, and Visha Anupaha, Shastra Anupaha, Atapa Anupaha, and Pavana Anupaha, which are not affected by Visha, Shastra, and Atapa and Pavana. Next slide, please. Acharya has mentioned the collection of drugs according to therapeutic use. For the purpose of Virechana, we have to collect the drugs from Prithvi and Amuguna Bhuyishta Bhumi. And for the purpose of Vamana Dravya, land should be selected from, which is the different acharyas mentioned different colors for the drug parts. According to Sushruta, Sara collection during Vasanta Rutu and collection of Phala during Grishma and Mula collection during Pravud, like Patra, Tvaka and Shira, different parts are to be mentioned during different Rutus. Next slide. Next slide, please. According to Virya, collection of drugs are to be mentioned for the purpose of Ushnavirya Dravyas are to be collected in Agnya. Sorry. Ushnavirya Dravyas are to be collected in Agdiguna Bhuvishta Bhumi. And for the purpose of Shetavirya, drugs are to be collected in Varsha, Hemanta, and Shishira Rutu. And collection of drugs according to region is Agneya Guna Bhuvishta Dravyas are to be collected in Vindhya and Malaya region. And for the purpose of Saumya Guna, drugs are to be collected in Himalayas. Next slide, please. Next. Next. Dravya Sangrahana according to appropriate habitat. Medicinal plants are to be collected from Sadharana Desha or Jangala Desha. Plants should have been exposed to seasonal cold, sun, wind, and rain appropriately. The collected plants should grow over plains and clean land surrounded by water reservoirs. Next is Dravya Sangrahana according to wet or dry drugs. All Dravya should be collected dry and new except Guduchi, Kuteja, Vasa, Pushmanda, Shatavari, Ashwagandha, Sahachara, Satapushpa, and Prasarini. These are to be collected fresh. And for coming to the collection of Jangama Dravya, animal products such as Rakta, Roma, Nakha, etc. have to be collected from well-grown young and mature animals. Kshira and Mutra Purusha have to be collected from a mature and animal only after the previous food is digested by the animal. In the collection of drug collection during according to modern concepts, drugs are collected suitably when they contain maximum concentration of active ingredients. The advantage of existing environmental conditions are also taken into considerations. On commercial scale, attention should be paid for the use of skilled labor. Diseased plants or plants treated with pesticides are to be avoided for medicinal use and should be rejected during collection. For the collection of leaves and flowering tops, they should be collected just before the pollination or before their full blooming. Swarnapatri, for example, Swarnapatri should be collected individually from the plant, and Bruhati, Kantakari or leaves with the flowering tops are to be collected. For the collection of flowers, they should be collected before pollination. Next slide. And the condition should be fine dry weather and the forenoon before the few hours of sunshine when dew has dissipated. Collection of seeds. The collection time is when the fruits are ripe, but before the dahi is on the plant. Method of collection, it varies according to different plants. Collection of bark. Barks are to be collected only after 3 to 8 years of plant growth. Method of collection, it is collected by suitable longitudinal and transverse incisions on the stem or root of the plant. For the collection of hardwood, a large portion of most commercial woods consist of hardwoods. Hardwood is xylem tissue which consists of dead cells which has ceased to perform any conduction. For the collection of chandana, trees which are more than 25 years of age are normally selected for collection. And collection of resins, gums, and latex. Those are unorganized drugs. These are collected, resins, gums, and latex are collected as soon as they ooze out of the plant condition. Acacia gum collected 2 to 3 weeks after making incision on the bark of the tree and when it is sufficiently hard. Opium and papaya lattices are to be collected after coagulation of the latex only. In the scientific validation of Dravya Sangrahana, Ayurveda is the science of life practiced since ages. The vital aspects such as collection of drugs, formulations, standardization, and quality control are detailed in classical literatures in basic form and may be comparable to the various contemporary approaches. In the field of pharmaceuticals, the collection of drugs and materials should be deal with utmost care. They specified the parts of the plants to be used and time of collection. Uh, Observation and inferences drawn by the ancient scientists regarding the plant material appear very rational on the background of recently accumulated knowledge about the variation in phytochemical content of the plants, which is known to occur depending on the place and time of collection. And good collection practices of raw drugs and proper identification is most important. The place and soil plays a major role. On this background, the instruction to the physician about the method of collection, storage, and transport, in addition to the time and place of collection, were specified in the classical text. WHO guides also the same for the collection of plants. And the art of collection has its origin in the prehistoric period. The written evidences starts from Vedic period, suggesting its prime importance. In Ayurvedic literature, drug collection has been mentioned according to different parts of the plant in respective seasons, nakshatras, virya, and on the basis of therapeutic uses. According to modern science, the description of drug collection and practices are well documented in Ayurvedic literature, and its utility is validated by modern chemical tools for obtaining maximum quantity of active principles. The therapeutic efficiency is presumed to depend on the quality and quantity of secondary metabolites, which in turn are influenced by the method of collection. Acharya Charaka has mentioned that drugs become capable of producing maximum therapeutic effects when their potency is augmented by the Desha Sampat, Kala Sampat, Guna Sampat, and Bhajana Sampat. That's all. Thank you.
Thank you, Doctor. Next, I invite Dr. Srujan Suresh for the poster presentation.
Yes, sir. I am here.
Good evening, Doctor. Please share the screen,
Good evening.
Doctor.
Okay. Sir, can you share the my PPT?
Sure, Doctor. Just a moment. I will share for you.
Yes, sir. PPT is here.
Okay, Doctor. Please continue, Doctor.
Good evening, everyone. Myself, Dr. Suryan Suresh Tibulkar. I am a third year Karmanya PG student. I am representing poster of uh, Transprostegamon. In modern science, it is known as neonatal resuscitation. In Ayurveda, Transprostegamon mentioned by Ashtanga Sundara Uttarakhanda. There are 9 types of transprotein. First one is Ulba Parimarjan. Ulba Parimarjan is known as removing the amniotic sac from the infant. Mukha Vishuna means Virechan, Pichudarna, and Prana Pratyagaman, Garbhodak Vamanam, Snan, Jatakarma, Prasanam, and Nabinam Svedanam. In modern science, neonatal resuscitation in view of modern concept. There are four types: temperature, airway, breathing, and circulation. Resuscitation literally means when the infant is deprived of oxygen, an initial brief period of rapid breathing occurs, and its aspect they are continuous. Respiratory movements cease. Infant enter into period of apnea, when there is a resuscitation needed. During primary apnea, the heart rate begins to fall. Neuromuscular tone gradually diminishes, but the blood pressure remains normal. So we need to resuscitate the baby in case of asphyxia. There is a three types: uh, lung inflation, pulmonary circulation, and cardiac function. That is systemic circulation. We needed uh, equipment such as suction equipment, bag and mask equipment, intubation, medication like epinephrine, normal saline, uh, Lean hospice, radiant warmer, stethoscope. Syringes one, number one, number two. Feeding tube is also needed. Umbilical catheters. Resuscitation algorithm. Uh, to identify the term gestation, baby is crying or breathing, to be monitored. Good muscle tone, that is flexible posture or active movements of baby, denotes good tone. Temperature is also most common uh, parameter for the resuscitation, providing by putting the baby directly on the mother's chest in skin to skin contact. Clearing of airway with the help of suction with uh, with feeding tube. Ongoing evaluation for vital parameters like heart rate, uh, pulse rate, is saturation is also needed. Term gestation, provide warm, clear airway, if necessary, dry and stimulate. Heart rate below 100, gasping or apnea. It, it, it is continuous. Positive pressure ventilation are given. SpO2 monitoring. If heart rate below less than 100, then take a ventilation for corrective steps. If heart rate below 60, consider intubation, chest compression, coordinate with positive pressure ventilation. If heart rate below 60, give IV epinephrine or adrenaline. Routine care, routine care include provide warm, clear airway if necessary, feed baby dry, keep baby with mother, ongoing evaluation. Initial steps for resuscitation: warm, positioning, clear the airway, and dry and stimulate. Uh, in Nabinal Chednam, in modern, it is compared with a care of baby umbilical clamp. Uh, if the high risk delivery is anticipated because of presence of risk factors identified before birth, more advanced resuscitation may be required. In such cases, two persons should be solely manage the baby. The goal is should be provide resuscitation team with specified leader and identify role of each mother. For multiple births, there should be a separate teams. The resuscitation corner must be physically located in delivery room itself. The health professional designed to care baby at birth should be checked for resuscitation predisposition. At the birthing place will in time before the baby is delivered. Standard precaution and assistance of birth. The personnel attending the delivery must be exercise all the universe and standard precaution in all cases. All fluid from the baby mother should be treated potentially infectious. Gloves, masks, gowns should be worn when the resuscitating newborn. There are four main types. Uh, T means temperature, A means airways, B for breathing, and P for pulse. Temperature should be 36.4. If temperature less than 36.4, it is considered as a neonatal sepsis. Then check the airway with the help of stethoscope. Breathing with the help of stethoscope, we can audible to breathing. Circulating with the perfusion, uh, perfusion of the soul, we can uh, manipulate circulation. Okay, this is my post of neonatal resuscitation. Thank you.
Thank you, Dr. Srijan Suresh, for the nice presentation.
Yes, sir. Thank you.
Next, I invite Dr. Madhuri Vijay Jagatap for the paper presentation. Dr. Madhuri, are you there?
Yes, sir. I'm here.
Okay, doctor. Please share the screen, doctor.
Wait. Good evening, everyone. Hello.
Good evening, doctor. Your
Hello.
screen is visible. Please start the session, doctor.
Yes, sir. I'm putting this, but didn't share, sir. Wait a minute.
Doctor, you have any problem with screen sharing, doctor?
Yes, sir.
But now your screen is visible, doctor.
Visible?
Yes, doctor, visible.
Yes, yes. Thank you. Good evening, everyone. Myself, Madhuri Jagtap, third year PG student from Shalyatantra. Here I am presenting the head injury. Introduction. Head injury is a broad term that is describes a variations of the injury that occurs to the scalp, skull, brain, underlying tissue, and the blood vessels in the head. Head injuries are most commonly referred to as a brain injury or the traumatic injury, depending upon the extent of the head trauma. The head injury accounts for the 3 to 4% of the emergency department attendance, with around the 1500 cases per 1 lakh population per year in UK. Annual mortality attributable to head injury is the estimated at 9 per 1 lakh, and it remains the leading cause of the death and the disability of the childhood to early mid age, which and the estimated 2% of the US population suffering long-term disability as a result of the head injury. Traffic accidents are the leading the cause of the head injury, responsible for the 50% of the cases and others. Etiology of the head injury. Here is the assault uh, due to assault that there are the 10.7%, fall 40.5%, unknown or the others is the 90%, and the truck by the 15%, and the motor vehicle by the 14.3%. Classification of head injury according to location is the scalp injuries, skull injuries, and the brain injuries. According to the severity, minor head injuries, mild head injuries, moderate head injuries, and the severe head injuries. The scalp injuries are included according to the layer, which are the skin, S for skin, C for connective tissue, A for aponeurosis, L for loose connective tissue, and the P for peristome. Treatment given is the first treatment is the AID treatment, shaving, debridement, arrest of hemorrhage, and the scar suturing. Complication, there is a infection of the skull. Skull injury, skull injury. There are the fracture of the skull, and again there is a fracture of the vault of the skull. There are the many fractures, which types are the linear fracture, simple or combined fracture, and depressed fracture. And there are the fractures of the base of the skull, fracture of the anterior cranial fossa, fracture of the middle cranial fossa, and the fracture of the posterior cranial fossa. And the base of the skull fracture, there are the anterior fossa, which is signs are the Rocon's eyes, hollow sign, partial and the total loss of the vision and the smell.
eye movement defect, and if there is a middle fossa skull fracture, there are the signs are the damage to the carotid artery, hearing loss, loss of the balance, and the battle sign. Brain injuries. There are the brain injuries are the classified as the primary and the secondary. Primary. The first type is due to the movement of the brain within the skull box, causing the shearing forces due to the deceleration and the acceleration. Secondary type of the brain injury, it is due to the localized injury to the brain against the rough internal configuration of the skull, flanks, and the tentorium. There are again three types: cerebral conclusion, cerebral contusion, and the cerebral laceration and cerebral compression. Secondary brain injuries, there are the brain swelling, hemorrhage, brain necrosis, and the coning. Intracranial hemorrhage, there are the hemorrhages, types of hemorrhages or the hemorrhages that may be caused. Extradural hemorrhage, intracerebral hemorrhage, acute subdural hemorrhage, chronic subdural hemorrhage, and the traumatic subarachnoid hemorrhage. There are the layers of the layers within the hemorrhage can be caused. And examination, we take the proper history, type of the accident, level of the consciousness, PTA or the RTA, vomiting, epileptic fit, swelling, pain, other complication, past history, and the personal history. Physical examination, we can examine the head, position of the patient, depth of unconsciousness, bleeding from the nose and the ear, eyes and the mouth, pulse, BP, respiration, temperature, and the neurological defect. There is a Glasgow comma scale, which can be the give the score that we can differentiate the patient into the mild, moderate, and the severe. Investigation, blood, X-ray, lumbar puncture, carotid angiography, EEG, then UHG, brain scan, MRI, and ventriculography. Management. The management is first attending the patient in the casualty department, indication for admission, general nursing care, retardation of the level of the conscious, which is the main phase in the treatment, indication for the surgery, special investigation, non-surgical treatment, early complication, and the late complication of the head injury. Non-surgical management, osmotic agent, which is the very important and the necessary. The basis for the use of the osmotic diuretic is to raise the osmolality of the plasma so that the fluid from the brain will be the drawn through the extracellular compartment later into the blood, thus the brain edema and the swelling are the reduced. So the solution is used are the hyperosmolar and non-diffusible. They should not cross the blood brain barrier and are not excreted so rapidly by the kidneys. Today, most commonly used is the osmotic agent is the 20% of mannitol. This is given intravenously to the adult in the volume of the 250 ml over the course of the 30 to 30 minutes. The effect of the mannitol is the lasted for the 3 to 4 hours. Fusimide is the another agent to be in this group, which is the almost used steroid. Uh, its benefits in the edema due to the blood tumor, dexamethasone, hyperventilation. The claim that the hyperventilation to a PCCO2 of the 20 to the 25 Hg lie mainly on the induction of the cerebral vasoconstriction by the method and so reducing the ICP. With the hyperventilation, the reduction of the ICP lasts longer than the after the administration of the mannitol barbiturate. Complication, leakage of the CSF, aerosol, meningitis, fat embolism, brainstem injuries, posterior fossa compression, pituitary failure, epilepsy, and the headache. Thank you. Hello.
Thank you, doctor. Thank you for this session.
Thank you. Should I leave?
Sure, doctor. We have come up to the end of the session. I would like to invite Dr. Aishwarya RS to conclude the session. Hello, Dr. Aishwarya. Please unmute, doctor.
Am I audible now?
Yes, Doctor. You are audible.
Thank you, Dr. Sabin. So it's an official end of Karmanya National Seminar. And although it was brief, but the seminar was quite informative. And I congratulate each participant who actively participated this series till now. And at the end, I would like to thank our each and every panel members. Without them, it couldn't happen. Thank you so much. And thank you all. Good night.